roll call to this evening?
I believe Dr. Buchanan is.
Okay.
I'm not seeing her right now. Did we lose her? I'm going to mute real quick and see it.
I'm good. Dr. Buchanan didn't know she was handling roll call, so.
Oh, I can handle roll call.
But I'm good. I can call roll. I know how to do that. I might go out of order because I don't have a piece of paper in front of me, but that's okay. I know.
We'll just do it. I've got it here.
We're good. Dr. Drake?
Here.
Dr. Hurt?
Here.
Dr. Gocher?
Here.
Mayor Jacobs?
Here.
Ani Roma?
Here.
Dr. Shamia? He was here. I think he's finishing up another call. Dr. Souza?
Here.
And Ms. Wagner?
Here.
And I also am here. So we are all here except maybe Dr. Shamia, who's going to rejoin us, I believe.
That's Dr. O'Brien.
Sorry, Dr. O'Brien. Dr. O'Brien?
I am present and accounted for.
Okay.
Good.
Great.
Okay. So I think we've got everybody here, so we've established a quorum. And the next order of business is approval of the minutes of the meeting from December 2, 2020. And these have been distributed to everyone. Are there any questions, additions, or corrections? If there are none, or if there's some minor things to go over, I'll accept a motion for approval in a second, and then we can discuss any of that, or go ahead and approve.
Motion to approve.
And a second?
Second.
So we have a motion and a second. Any additions, corrections, discussion? Hearing none, we can go ahead with a roll call for approval of the minutes, please.
This is Charity Menifee from Knox County Health Department to do the roll call for the minutes. Dr. Drake. Didn't hear you, Dr. Drake.
Yes.
Thank you, ma'am. Dr. Gocher?
Yes?
Dr. Hurt?
Yes.
Mayor Jacobs?
Yes.
Dr. O'Brien?
Yes.
Ms. Roma?
Yes.
Dr. Shamia?
Yes.
Dr. Souza?
Yes.
Ms. Wagner?
Yes.
Dr. Buchanan?
Yes.
Thank you. Passed unanimously.
So you have approved the minutes of the meeting from December 2. Next is setting the agenda. And the agenda that I have received was on the 14th, and there may have been some changes since then. I know I saw a last-minute resolution that came about 3:23 this afternoon from Dr. Buchanan. So in terms of setting the agenda, we can move to set it, second it, and then in discussion we can have some proposals that we can vote on.
Dr. Gocher, can I step in for a second?
May?
If I can go through this rubric with you. The Knox County Board of Health rules apply when they're explicit. When they are silent, Robert's rules apply.
Okay.
And under the Knox County Board of Health rules, any member may place an item on the agenda 2 days before the meeting. The sponsor of an item placed on the agenda may withdraw it prior to the final agenda being set. That is what you're about to do. Any matter submitted to be placed on the agenda after the deadline, that 48-hour deadline, needs to be approved by the chair, you. Under Robert's rules, two-thirds vote is necessary to add items to the agenda. If that's in the case, something doesn't apply under the Knox County Board of Health rules. So you have two changes that I'm aware of here, two proposed changes. One is the removal of proposed resolution 2020-C. That one was submitted more than 48 hours in advance. A request to withdraw was made by the sponsor. Therefore, I think under under the Knox County Board of Health rules, that proposal is simply withdrawn. There's no further action necessary here.
Okay.
Then regarding the addition of proposed resolution 2020-D, which would now actually become C, it was submitted on the day of the meeting. You as the chair have the authority to place that on the proposed agenda before finalizing the agenda. If you choose not to do that, then you have to have a motion, a second, and a 2/3 vote.
If I choose to, then do we still need a 2/3 vote after I choose to put it on?
No, you just need your normal vote for approving the agenda at that point, because the rules of the Board of Health give you the permission to simply add it to the agenda. If you choose not to exercise that discretion, it can still be added to the agenda on a motion, a second, and a 2/3 vote. That's how I see the procedure breaking out. But I wanted to go ahead and establish all that so you knew what was going on before you started calling for a vote.
Got it. Thank you, Mr. Sanders. So with those modifications, one proposed resolution having been withdrawn, I've had an opportunity to read over the new resolution, and I would like to just exercise the ability to put that on the agenda. And we can, look at it, vote it up, and vote it down as a group. But I would like to have it on the agenda for this meeting, please.
I'll make a motion to approve the agenda.
I'll second that as amended.
Any other discussions, concerns, points about the agenda?
Yes, this is Maria Hurt. I would like to add to the agenda just that we set aside some time to discuss as a group the county commission's discussion. They're drawing up basically an ordinance that profoundly affects the Board of Health. It's a little unclear from reading the transcript what the intention is, whether to dissolve us or reform us, disband us, reform us, et cetera. But at any rate, I'd like for us as a group at some point in our meeting to discuss that.
Dr. Hurt, if it's okay, in other business, we could discuss.
Sure.
It. We perfectly.
Sure.
Okay. Any other discussion? We have a motion and a second to set the agenda as amended. Any other points of discussion, concerns, questions? Hearing none, we can go ahead and call a roll call for a vote to set the agenda then.
All right, the vote to set the agenda, Dr. Drake,
Yes.
Dr. Gocher,
Yes?
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan,
Yes.
and it passed unanimously.
Thank you. Moving ahead then, the next item on the agenda is the Knox County Health Department's benchmark presentation by Dr. Buchanan. And Dr. Buchanan, if you're ready, we will give you the floor for that presentation, please.
Sure, thanks. So first I'll, I guess I'm having to pull this up on my computer, so I can't see the screen that you're sharing, Catherine, but you have it up there, so we're good. So now I have to find it again. Sorry about that, guys. Catherine, can you minimize your screen for a second? Thank you. I apologize. All right. Thank you. So looking at our local situation, we have 472 new confirmed cases since yesterday, giving us 4,274 active cases, which is up significantly since the last time we met as a board. We've been averaging closer to 400 new cases a day over the last several days. We currently have 128 Knox County residents in the hospital, And sadly, we actually have 11 additional deaths to report, raising our total to 234. This is the highest number of deaths we've reported in a single day. And we've been averaging somewhere between 3 and 5 deaths a day for a few days. Charity might be able to give more specifics on that, but that's probably the most concerning piece of our data that I have to share. Moving on to the first benchmark, sustained reduction or stability in new cases for 14 days. Over this time period, we once again hit a new record high in case volume, with average number of cases per day trending up. Because of this factor, we are marking this benchmark as red. Our second benchmark, community-wide, sustained and increased diagnostic testing with consistent or decreased test result turnaround time. Regarding testing, the total number of tests conducted has increased over the recent weeks. However, the issue we continue to see is that lab turnaround time over this time period, it would continue to average 6 days across the community, some being faster, some being slower. So we are going to continue to mark this one as red as well. Third benchmark, sustained or increased public health capability. Based on our internal assessment of our capabilities and acknowledging the need to prioritize our case investigations and contact tracing, we again will represent this as red. With the volume of cases that we're having, we can't bring on enough people to adequately contact trace. And as we've announced in the past week, we're changing our prioritization of contact tracing. So we're not contact tracing those folks who are, the case is more than 6 days old from 6 days out from testing once we learn about it, unless they're over 80 or under 18. So we're trying to prioritize the most at-risk groups. Benchmark 4, healthcare system capabilities remain within current and forecasted surge capacity. During this time period, flags were noted for positive inpatients, ICU patients, and ventilated patients. After speaking with our hospital partners, they have recommended that this benchmark continue to be red as well. And our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. Excuse me. Deaths have continued to increase in our community. During this time period, we have seen 19 deaths related to COVID over the past 7 days and 38 in the last 14 days. So this information also leads us to continue to have this benchmark as red. Under supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of yesterday, our 14-day trend line shows 82 new cases per 100,000, and the 7-day trend line shows 97 new cases per 100,000, both of which are up from last week and the last time we met. The second chart shows the percent positive COVID this data is received from the Tennessee Department of Health. The 7-day average for percent positive here in Knox County is 21.75, which is above the threshold for the metrics the board has adopted for regarding escalation. So any questions, concerns?
Dr. Buchanan, thank you for that report. Any other discussion on the benchmark report from Dr. Buchanan?
This is Maria Hurt. I just want to say, there's, thank you, Dr. Buchanan, and thank you to your team who tirelessly doing the best they can given the challenges we have as a community. But I just want to say, it's concerning. I mean, that goes without saying, but I don't want anyone who's listening, just because we're not peppering Dr. Buchanan with questions, to think that this data really isn't profoundly sobering at the very least, and really heart-wrenching. That's all I want to say. Thank you.
Thank you. If there are any other points of discussion on the benchmark data? If not, again, thank you for that presentation, Dr. Buchanan. And we'll move next to University of Tennessee Medical Center Knoxville's data update with Dr. Shamia.
Great, thank you. So we'll jump right in to the next slide, please. So if we look at our new cases by week and by month in the county and the district, a few things jump off the page. First of all, if we see in the county, just those last two bars of the 2 weeks since Thanksgiving, you see the number of cases, how much they spiked at 2239 and then 2885. And you see below in the district just how significant those cases took off. When you look over on the right-hand side for the month, you see that 15 days into December, we in the county have already exceeded the entire month of November. So that gives you an idea of what the entire month is going to look like. And similarly, in the district, 15 days of December have exceeded the entire month of November. So those bars are going to get a lot higher by the end of the month for new cases. Next slide, please. So this is across the state, and I think that one of the things to point out here is that obviously the scale keeps changing. So you got to look at the left-hand side, and it's not the same on the four graphs. But not only have we had two very significant pickup weeks in terms of new cases, but now our closest peer is Davidson County. And the point here being that we've got certainly a smaller population than Davidson. And so we know that this is in part driven by population density. So that gives you an idea of just what we have in terms of case growth. The other thing is, since we're looking at this graphic of the entire state, I think this has been reported in the news, but there's a website called COVID Exit Strategy that looks at new cases per million over the last 14 days. And although I've heard it both reported as 1 and 2, Tennessee has 1,215 per million, which puts us at least right at this moment as the fastest growing state, or the state that has the most new cases per million in the country. Next slide, please. Let's kind of go through this just a bit, the age demographics. So unlike the last few weeks, now what we see is that the case growth is increasing in every age demographic, not just the 51 and over, but clearly this most significant growth is in 51 and over. And also that scale has to keep changing because that bar keeps rising at a significant pace. So next slide, please. So this is that snapshot of, again, this is the only slide that's just our hospital because I can't get this anywhere else. But this is a single day of patients in our hospital and their age distribution. On the left-hand side is in acute care. On the right-hand side is ICU. And so while acute care is very much driven by those 45 and older, those 45 cases of those 70 and older, you see in the ICU, there's more of a distribution, but also this also drives home the point that there are people in their 40s, 50s, and 60s who are sick enough to be hospitalized with COVID-19. Next slide, please. So this is just another way of depicting positivity rate. This is our 7-day positivity rate, and you see just to the extent to which we're over 20%, and that over the last week and a half, 2 weeks, there's been a significant spike in that positivity rate. Next slide, please. So then to wrap up these last few slides with hospitalizations. So these are new hospitalizations. We've always talked about how there's the data lag here. If you look over on the right-hand side, you see that, again, new hospitalizations in December with 15 days in are certainly at pace to exceed November. I think that part of this story is just that we're really just getting into the hospitalization spike after Thanksgiving. I showed you a few slides ago the case spike after Thanksgiving, which we're already experiencing. But remember, sometimes it has to go through a few additional weeks of a case spike before we start to see it translate into the true hospitalization spike. Next slide, please. So this is our hospital census across the THA Knoxville district. And I've talked through this before, but we see that we're on this steady rise, most recently at 523 cases. And although it's not clear exactly based on that rise, remember I said that the majority of that rise has been more related to cold weather and people staying indoors. And we're really just now getting into what we anticipate to be the true post-Thanksgiving hospitalization spike. Next slide, please. And so these are the projections. I'll always say that, this is 30 days out, and we really don't know what it's going to look like in 30 days. The point here is quite simply, if you look at the projections from these last several weeks and also just how steady that line upward has been, the last several projections have lined up fairly consistently with each other. We know, and we've said repeatedly, that the vaccine is the light at the end of the tunnel. But we certainly don't expect the vaccine to be impactful in the next 30 days on the level, or certainly the next probably 60 days in the level of community transmission that we have right now. And so I don't know if we're going to land where these projections say. I've always said take it with a grain of salt because it's trying to predict the future. Next slide, please. And then, and to that point is that because there's nothing fundamentally different on the horizon right now, there's no reason to think that the situation is just going to auto-correct itself or just correct itself in the near term. We know in the longer term, even just a period of months, and not even that many months, we know we're going to see some good news with all the great vaccine news that's coming. But in the near term, there's nothing to say that this should just automatically correct itself. So, Dr. Gocher, that completes my presentation. I'd be happy to take any questions.
Thank you, Dr. Shamia. Were any questions or comments for Dr. Shamia? If not, Dr. Shamia, I had a question. We look at data from the geographic area here, not just Knox County, but I know that a lot of the smaller hospitals in rural counties have a limited number of intensive care units. I mean, they have maybe an adequate number of acute care beds. They have a limited number of ICU beds, and the ability to take care of the very ill patient might be somewhat limited. And so, how is that? What I would say is a predicted shift of the most sick patients to the Knoxville care system. How is that going to affect Knox County? I would assume that we will have an escalation where we may really be short on unit beds as well as acute care beds. Is that in the predictions? Can you comment on that?
So I can. One thing that we've talked about before is on that community capacity call that we have 5 days a week, and we're prepared to have it 7 days a week if needed. We are very much looking at which hospitals, where are the beds and where is the need? And so some of those outlying hospitals that may not have many ICU beds, certainly the systems that, there are systems that have some of those hospitals, so they're already managing that within their own system. Mm-hmm. But if we ever need to do that type of management across systems to make sure that a patient in one region gets to an ICU bed, we can do that. We have noticed that there seems to be a trend toward more of the ICU population on ventilators than what we've seen in the past. There are still plenty of ventilators available, but we have seen that. And so we feel like we'll be able to manage that. But to your point is that there will come a time where if the ICU capacity in the periphery really becomes totally full, then there would be the expectation that more of that would be sent into Knox County.
I think we're fortunate to at least have regional hospitals that are part of the system where those transfers can be effected a little easier. In some areas where they do not have systems like that, I know in my home state that some rural emergency rooms are looking over 4 states trying to get a transfer in. So certain parts of the country are really problematic, and at least our systems are allowing us to accept some of those patients. So, that's a bright spot in that picture, I think.
Dr. Gocher, there's one other thing before other questions I do want to clarify, and that is that, the effect of it's only going to get colder. We still have these times where we have weekends where, people are able to be outside more. But as we get into a colder time of year, people just tend to be in close quarters more. And so that, that between being together for the holidays and just being inside more because of cold, there's the expectation that leads to spread. Not to mention that respiratory viruses tend to proliferate more in colder weather. So that as we look to more temperature change, that's something to be aware of.
Thank you.
This is Maria. I have a question for you, Dr. Shamia, and thank you for your presentation. You have mentioned in the past, and those of us who've been in healthcare know that staffing is a really critical piece of making sure patients get the care they need. And so I'm wondering if you can speak to any data you might have or your sense of feet on the, boots on the ground in terms of staffing, nursing staffing, allied health, ancillary support, that kind of thing. Is that stable? Is it on the bubble? What are your observations?
So three things. First of all, we do have, and we're not unique, all the systems in town have significant illness in their staff. So that's dramatically, predominantly COVID exposure outside of work. But if they're when you're at 20% positivity, there are people who are going to get sick. So that has definitely put strain on staffing. When you add that to the idea that if that curve continues and we're trying to open additional surge areas, those are not surge areas that come with staff. And so it's that intersection of staff with illness and then trying to potentially operate more areas. That's where we're potentially calling on staff that maybe they're not currently at the bedside, but they've been recently at the bedside. Other ways that we can leverage the staff that we have and their particular skill sets. Maybe they're an extra set of hands as opposed to being, the nurse that is caring for a certain number of patients. Maybe they're helping that nurse care for those patients in some way. This is where the vaccine comes in, though, and I'm not sure that all the hospitals are following really the Tennessee Department of Health and the CDC's guidelines about the order to distribute the vaccine. But part of that order is to try to maintain the infrastructure of the healthcare delivery system. Is that if we have 6 staff, we cannot manage a surge. And so the prioritization of that healthcare staff is because they're on the front lines, sure, but the intent is to keep those people healthy as we go into this next phase of the pandemic. So, staffing is our issue. We've said before, we have space to surge, and we have redundant equipment, and we're fine on ventilators. The staff is what we think about the most to be able to manage through a surge.
Thank you.
Any other comments or discussions on Dr. Shamia's report this evening? If not, as always, we really appreciate it. Timely and just really good data.
Dr. Gocher?
Yes, Dr. McKean.
I don't have a question for Dr. Shamia, but my staff just reminded me we had some other data that we would like to share with the board that our epidemiologists pulled together just to kind of paint a picture of how things have changed and where we are with the recent change in cases. So Charity, do you have that PowerPoint?
It's not a PowerPoint. It's actually just provide the information.
Okay, sorry. I thought there was a slide. Okay.
That was different info. Sorry, it was just attached to the same one.
Okay.
Do you want me to go over it?
Sure, you can go over it.
Our Roberta Sturm, our lead epi, just pulled some quick data for us to just give perspective to what the past month has looked like starting December 1st. And so looking at just the past 16 days since December 1st, 26.8% of all of our cases so far have occurred in those 16 days. So that's 6,762 cases. In that same time period, 51 individuals have lost their battle with COVID-19, and that is 21.8% of all of our fatalities throughout the pandemic. In the last 16 days, that leads to an average of 3.4 individuals every day. So what Dr. Buchanan said earlier was correct there during that time period. And then we have averaged in that same time period, that 16 days, 397.8 cases and rising per day. So we just want to make sure, kind of just to put this month and where we are right now in perspective for everybody.
Thanks, Charity.
Thank you, Charity, for that information. Any comments or questions on that this bit of information, sort of an addition to Dr. Buchanan's report? If not, again, thanks for that timely information. The next item on the agenda, item 8, is questions for educational institutions, and there were presentations that were sent out to us, both from the University of Tennessee and Knox County Schools. Any comments or discussions about any of those reports? I know Ms. Wagner's here with us from Knox County Schools. Ms. Wagner, any additional information or any clarification on the report from Knox County Schools?
No, it's just that, we went and read this week. So all the students are virtual beginning this past Monday. And the cases, we still have cases, but they have went down some.
Thanks. Thank you. Yeah, that was in the news, of course, earlier this week. Any discussion on the University of Tennessee's report from anyone? If not, we appreciate those respective institutions presenting that information to us. Dr. Buchanan, do you have any discussion on either of those reports I see on the screen?
I do not.
Okay. So if there's no other discussion on the educational institutions, we're going to go to proposal 2020B, if my agenda serves me correctly, which is a resolution to Governor Lee about reinstating Executive Order 17. Dr. O'Brien, I think you were the author of that. Would you like to proceed with the discussion?
Yes, thank you very much, Dr. Gocher. First thing I want to tell everybody that relates to both of the one that was pulled and this one, these were put up as drafts, as hold a place for us to be able to put together something to go to the governor. So I'm going to be honest, what you see there is not what I anticipate at all we would send to the governor. I had conversations with a member of the Unified staff in Nashville, and it was recommended that if we as the Board of Health could speak to the governor with a resolution of some sort of our desires, that would be best for us. When I put this together, the one that we are considering, this was taking the next step from where we are now and basically putting into place what was in the Executive Order 17. I put that down again as a placeholder and not necessarily as the final action or what I would even recommend. I want to be able to use this so that we could have a resolution, and I would like to see if we could come to some terms to get something to the governor and his staff from us. I was told that is the best thing to get his attention, and I think that, and I'll just say personally, I think the one thing that we as a group may agree on would be one basic thing, that is to have a statewide mask mandate. What I had written down was, again, if it was escalated. I don't know that Tennesseans, and I know here in Knox County, I know that we are not in favor of having any more orders put on us than we have right now. It's really tough. There's a lot of blowback from our community. I know there's a lot of anger. There's a lot of concern. And I think we as the Board of Health need to be realistic and come up with some way to express to the state government what we feel may be most beneficial to us here in Knoxville, Knox County, and the rest of the state. One thing taken off the state's website today, it says we're at 65% mask usage on average in Tennessee. That's today's stat. It says our social distancing right now in the state is only minus 20% from normal, so that we are not doing a great job on that aspect. We are, as a state, unfortunately, still getting together a little bit too much. The state website also said the predicted number of deaths across our state right now should be about 50. We had 74 yesterday. So we're almost 50% above the prediction. And then as we mentioned earlier, there is a website that keeps track of statistics. We were, as Tennessee, not only the worst in the nation, we were the worst in the world on our number of cases per 100,000 for the state of Tennessee. So we beat, if Tennessee was a country, we would be the number one country in the world with 3 other states behind us and the country of Lithuania, number 5. That's the statistics that were published within the last 24 to 48 hours. So we're on the wrong trajectory. So what I would like us to discuss is how can we take what I put down as basically a straw man, a way for us to hold something and make it into something that we can agree upon that we would want to ask the governor to consider. And I would put as the floor of this asking for a statewide mask mandate, because we really need to have something in that regard. We need to get up above 65%. It's good. It's not good enough. So I'm going to open it up to people. And I want to tell the public, again, I'm sorry that this scared you. I'm sorry this upset you. But we as a board don't have a way to communicate among ourselves and to put something on an agenda. I should have done something that was more vanilla, and I apologize for that. But this is a way we can do action tonight versus having to hold off and wait 2 more weeks to come up with something, a resolution to send to the governor's office. So that's the reason for these. We really only needed one, and I would like to open it up and see what people think we could tell or ask the governor to assist us with.
So Dr. O'Brien and board, as a first order of discussion of this formally, I think we need to have the proposed resolution brought forth as a resolution for consideration with a second, then we can entertain discussion.
Well, I'll go ahead and put it up and request be the first on that we go ahead and accept this, please.
Is there a second?
I second it.
Okay, so we have a motion and a second. Further discussion, please.
Just a clarification point. So we've got this agenda item, and then there's the one that follows. And so, Dr. O'Brien, and I know we have to stay in the order of the agenda, but are you implying that somehow these are in some way part of the same conversation?
The number C was withdrawn. Actually, that was withdrawn but never showed up. We were told it could not show up as a withdrawal on the agenda.
Okay, sorry.
Technical rules. So that is not even on the agenda. So I want to tell the region, don't worry about that. We're not going that way.
Okay, thank you.
So I guess I'll go ahead and I support that you had a placeholder, and I was a little bit worried that I was going to have trouble with this resolution. I do feel strongly that we need to have a statewide mask mandate. So many of our surrounding states have it. And I think that it's a little bit sad that we don't, particularly if you look at the cases that we have. So I'd be fully supportive of a resolution asking Governor Lee. And I know that I've written their office previously and said that we need to do something because we're going in the wrong direction.
Other folks' thoughts, please. And that's what I want to do, is amend this to equal what we want to be able to send something to them from tonight's meeting.
This is Maria Hurt. I want to say thank you, Dr. O'Brien, for pulling one of the proposals. I really was very uncomfortable with regional control. But like Dr. Sousa and many people in our field, I really believe that a statewide mask mandate, it sends a message. It's really a point of leadership. It's not about control. It's not a power grab. It's about sending leadership, sending a message. And I believe that really will. And we know that. I don't have to believe it. We can look at the data from other states, other countries that have enforced mask mandates and see their numbers go down. So I'm open to the proposal that is on the table being amended to address a mask mandate. And that was going to be my question, is how about we begin there before we start, proposing resolutions for something even more restrictive. Those are my thoughts.
So,
and just to add to that, I guess, remember when we had the presentation from Dr. Cahill from the Baker Center, and she went over the survey that's been done across the state of Tennessee, and people, the vast majority of people are supportive of mask mandates. They think that they work, they trust the science. And so it's actually a fairly small percentage that responded to that survey saying that they don't want to wear them. And so if we can at least get more people in them, it doesn't have to be everyone, then it can help.
So one point of discussion is that the resolution that's before us is for Executive Order 17. I'm assuming everybody's had a chance to read Executive Order 17, which was, about mid-March, I think, where basically gyms were shut down, restaurants, except for takeout service, were shut down, and that was part of that national movement where I won't say things ground to a halt, but there was a pretty much a pullback of services, and that's what we're debating right now. But we can certainly work on trimming this down or adjusting it however that the board would see fit. But just to know where we're starting from Executive Order 17.
And as the proposer, I am very willing to start by taking that out and by starting with a foundation of a request of the governor for a statewide mask mandate instead of all of that. That was taking, if we took where we are right now, the only way if you were going to add anything was that way. I personally don't think we can do that. Some things are sometimes proposed that look onerous for a reason, so that we realize they're onerous, that we don't want to go that way. And instead, I think what we need to do is look at something that's more realistic and is more helpful to the people around the state. We don't need any more deaths. I looked up, we have more deaths in the state of Tennessee right now than there are people in Pickett County. That's unbelievable. One of our whole counties would be gone just based on the deaths we've had in this state. So I would be more than willing to change this to a request for a statewide mask mandate instead.
So, Dr. O'Brien, just in terms of, you've clearly had some sort of, you've had conversations or guidance in some way that there's at least the possibility that whatever action it might be could have an impact. And that's really what I want to push a little bit on, because we've been saying, and I know I've been saying, that this is a regional issue. It's been that for quite some time. It's clearly now a statewide issue. And the State Department of Health, and for that matter, all of the officials at the state, have the ability to look at the same exact data and are fully aware of the situation just as much as we are. And so while I understand the desire to do something, given where we are, I guess I would just want to have some sense of the feeling that this was more than just a purely symbolic act, that, again, where we were in some way treating ourselves, but that it wasn't really going to change anything. So if we're going to have this discussion, do you truly, sir, have the sense that is has the potential to occur?
I think it does. The advice I received from a member of the Unified Command staff was that it's okay for each of us to express our desire and send an email or something over to the governor, but organized governmental agencies, groups, boards, commissions that speak for certain areas carry more weight. So I was informed that if we wanted to do something as a board, that this would be presented to the governor as something from our board, and that this could come from the Knox County Commission, from the City of Knoxville Council, or the Town of Farragut Board of Mayor and Aldermen. Same sort of thing can be done to give a sense to the Unified Command staff and the governor at their staff meetings that this is something we feel strongly about. So I was told this is probably our best route to try to get that to occur.
So Dr. O'Brien, and you, I'm sure know more about this than me, but in my sort of studying the governor's responses over the last 8 or 9 months now, there's two things that sort of stand out to me. One is that he believes that if we educate the public, that the public will respond, number one. And number two, that each county in the state has a different set of problems, so that they should respond individually. And about that second point first, that might have been true in March, it might have been true in May, but I just don't think it's true anymore, because the spread into rural areas is so pervasive that it's truly a statewide problem. In terms of education, I mean, there's a lot of PSAs out there. We hear them all the time. I think they're actually well done, but I don't know whether the penetration of those PSAs is doing the job. I would like to see, some increased activism on the part of the state government. It would help us all out. I would hope that this could help with that. Frankly, not optimistic, because over the last 8 months, I've seen a lot of push towards these sorts of things with pushback occurring at the state level. So anything, if this is a change in philosophy, I'm all for it. I think that would be great if the governor responds,
I don't know if he will, but I was told this is our best chance now that we're at this point in this pandemic to maybe see if we could impact his thought process and see if he might come along. He is held pretty hard and fast. Other similar Republican conservative governors have already made the choice to do statewide mask mandates, such as in North Dakota. That was mentioned in a conversation I had with the staff there. So, things don't look good right now. You don't want to be number one in the world. It's bad to say we're number one, and it's because we have the worst COVID, percentages per population in the world. So I think now's our time to strike with this. I think this is the only way to do it, is just a statewide mask mandate. I think any more than that, given where we are, is not going to make a big change. We do need help from our citizens. It's been noted, we've had some churches, which we don't control. We've had some other groups get together. We have some people who get together in certain bars and other establishments who are still trying to live their lives as they did before the pandemic. And we really need them to take part in this. And we really need to see a change there, because, again, we need everybody involved and we need everybody's help. So, again, I think we need to go this route, and I think going with the mask mandate would be our best bet.
So, Dr. O'Brien, I don't disagree. I think asking to go back to Executive Order 17 it's a big leap from where we are now, given all the social and political goings on. I'll just leave it at that. But I also, I know that the governor has said that the county mayors can put their own mask mandate in place if they so choose. But at this point, this is a statewide problem. It's not limited to any one county. It's not limited to our metros, and it's impacting the economy in our entire state. And if he were to put a mask mandate in place, it does send a message to our citizens. He's the leader of our state. And if he says that and puts that out and supports it, that just sends a different message than the Board of Health doing it in Knox County. So I would support that. I would also, I know the PSAs look good, but PSAs, I'll be honest, don't do a lot to change behavior. And there's good data to support that. And people have been educated. I mean, people, know what to do. And maybe, I don't know if the other thing to add is, I don't know if the chair would entertain sending a letter to the chair of commission, city council, board of aldermen, Farragut board of aldermen, asking them to do something similar, asking the governor to do some the mask mandate across the state as well. Perhaps if he hears from several of us, he might consider that.
Dr. Buchanan, I'm glad you mentioned that, because that was going to be my question, is what is the precedent here? Have other boards of health in our state, across the nation, have they done similar measures? And who else is willing to locally to sign on and sign up to urge our governor as our leader to implement this? What do we know? What's going on statewide or nationally in terms of precedent? And with the county commission, et cetera, et al., be on board.
Right. So I'm not aware of any board of health across the state asking the governor for statewide mask mandate or any other kind of mandate. I think probably the Board of Health in Nashville probably has more of a relationship with the governor's office than anybody else, just because of proximity. But the other boards of health are not significantly involved in the health department's response. Most health departments are operating under a task force model, and the Board of Health may have a representative, but they're not the primary group making those decisions. It's a different makeup of the group. And I do know that he has been petitioned by lots of folks to do a statewide mask mandate at the individual level. I'm not aware of any groups, but that doesn't mean, well, actually, I think, wasn't there a bunch of doctors who sent something to the governor at one point asking for that? I mean, we are just in a different place in our state. Our deaths are continue to rise, not just here in Knox County. So, and if we do change this to do mask mandate, Dr. O'Brien, the one thing you might include is, data from here, but some of the data you just talked about the statewide data is really a more compelling argument as the leader of the state to make a change, because if all we talk about is Knox County, he's going to say, well, you guys can make your own, you have a mask mandate. Why do I need to do one across the state? And he may still say that, but it might be more compelling. If I'm a leader, it's more compelling to see data about what I have leadership over than some other area or just one part of it. So just a thought.
One thing I'll bring up, that in these statistics for Tennessee counties, it showed the top 3 counties right now in the state for percent of population: Scott County number 1, Union County number 2, Sevier County number 3. So that's an issue. And I've spoken, to people in other counties. I've spoken to one of those counties' mayors, and I think there probably is now a time that we could get some of those folks, if they have group organizations, to go and maybe write something up and get it to the mayor, to the governor. So, I think we're almost at a point we may want to pull up what I had proposed. I don't know if anybody else wants to make comment, and then we could amend this and actually try to make it into a resolution that we can go ahead and approve and send to the governor. Does anybody else want to make comment before we maybe pull that up and try to edit it?
Dr. O'Brien, I just had 2 questions, and you may know the answer. Do you know whether the Tennessee Medical Association or the Tennessee Hospital Association has brought forth a similar request to the governor?
Oh, I'm sorry. I don't know formally if they have. That's something we could check with both organizations, but I don't have that right in front of me.
I mean, each of our respective professional organizations can be requested to do this. I I could easily get a hold of the executive directors of the Tennessee Dental Association and have them do this. I mean, we're all in each of our own ways affected, and maybe those professional organizations can create more of a mass effect as well.
Dr. Gocher, before we get to the specific resolution, just in a broader sense, one thing I'll say is that the people who have probably the most influence right now, and certainly the governor would be one of these folks, are the ones who, for whatever reason, based on how they view the world, how they believe certain things, have resisted these types of things. Because the people like Dr. Buchanan, who've been beating this drum the whole time, they've either listened to her already or they're not going to listen. And so as the situation potentially gets worse, I think the people who have the most potential to impact the outcome over the next 2 months are those who, either because of a personal situation or because of the data or maybe because of what we're talking about here, switch their thoughts. And it may be that, look, I don't want to do this. I'm not happy about this. This is not how I view the world, but I feel like the situation that we're in, we need to do this. And so I don't know that this is going to have that effect, but I feel like those are the people that have the most potential to influence behavior at this point, because seeing someone switch or to view it differently because it's gotten worse is much more impactful than the people who've been saying the same thing the whole time.
Yeah, just one quick follow-up, that thinking of other people that might actually send letters of support for a statewide mask mandate is actually reaching out to industry. Because if you think a lot of large, be it Nissan down near Chattanooga, a lot of those places where they've got people in close quarters are already requiring mask mandates in their facilities. And so getting those on board, and I'm not sure the best way to reach out to those, but having industry, since it's such an economic driver, on board as well.
Yeah, it might be good to get the organization or the group that was put together with Governor Haslam here locally and Randy Boyd and Mayor Jacobs, Mayor Buchanan. Maybe as a group, that'd be another group of individuals that could stay together. We would really like you to consider going this route.
Any other comments on the proposed 2020B? Knowing that if we moved and seconded it as stands, of course, our discussion, I think, has been that we really don't want to proceed with Executive Order 17. Dr. O'Brien, thoughts on how you would craft this? You want to keep the whereases the same and craft a therefore that would strictly be a mask mandate? I offer that as just a simple suggestion.
We could do that. We may want to add one more whereas, which are some of the stats off the state's website today. Whereas mask use is listed at 65%. Let's go ahead and pull that up and we can see here. So we can take out the second to last whereas is what we can do. And I don't know if this is something that we should have Mr. Sanders or whoever, if you all are, well, there you go. If you can do it from there, just to take out the ones that talk about Executive Order 17.
Dr. O'Brien, this is Charity Menifee. We have the PDF version pulled up.
Okay. I don't know if Mr. Sanders still has his Word version, of this.
You can edit a PDF. You should be able.
We don't have we don't have the software on this computer to do that.
I do have the Word version. Give me a second and I'll email it to Charity. Is that who I need to email it to?
To Catherine Killen. Catherine, I think you have her email. Yes, he does.
Yeah, I do.
I think once we do that, when we get to the now therefore, it's going to be simple that we're going to request the governor to initiate a statewide mask/face covering mandate. So that would be the easy part of this. And then we might add, like say, a whereas using the state's own statistics from their website from today. I know this is a little messy doing it this way, but I figured this is the best way we can get it done today versus waiting 2 more weeks. I apologize again for that.
We will let you
Yes,
know when it comes in.
I'd just like to tag on to that, Dr. O'Brien, and say I frequently encounter in reading emails from the public a lack of knowledge or understanding that we on the Board of Health cannot talk to one another outside of real time right now in our meetings. So we can't discuss, we can't email, we can't call each other up, we can't text, and we don't. And so this is the time we have to be on our feet, think on the spot, and be a team. We don't have any opportunity to do that except during our meetings.
That came up in the last few days with me about this, and somebody asked, well, why don't you all have a chat room where you can work on this? So I said, well, no, that was not approved. Some place for us to post and work on things, and that was not approved. We were told that was not legal. I have told that to a number of people who asked me, including a reporter yesterday, and they were wondering why were these put up. And I said, well, this is the only way for us to start with something, for us to talk about it and use it as our foundation. It's like what they talk about in the legislature, the General Assembly, as a caption bill. It's a placeholder to allow us to do some work, kind of like, as you say, on our feet right now, real time. So, okay.
All right. I have sent that to Catherine Killen, and it should be coming across. Now, that is the red line version, Dr. O'Brien, that I sent to you on Sunday. But I mean, it's actually, I've taken the red lines out and, of course, my comments out of it. But that is the base document. So if you made additions after you got it back from me, those are not reflected in it.
Yeah, that's basically it. And so we would take out the ones, the whereases for Executive Order 17. And we would request governability to initiate a statewide mask. I don't know if it should be mask or face covering. We could put / face covering executive order and take out the area from Executive Order 17 for a 28-day period. Take that piece out and leave the rest, I believe. And then we could add, if we want to, if you all would like, whereas the state of Tennessee COVID website on this date shows mask use at 65%, social distancing at minus 20% from baseline, and I'll ask you all to see if we want to put in something like this, that just a comment, more people have died in Tennessee so far than the entire population of Pickett County, just trying to give people a sense that this has affected a lot of people. So I don't know if we want to add that or not. I'll ask for your consideration on that one. We could just do this.
Dr. O'Brien, was that are those percentages correct?
It was 65%. Yes, that's what it says on the state website. And it says we were at minus 20% from baseline. 20, sorry, not 25.
Thank you, sir.
Minus 20% from baseline is what it said on today's benchmarks on the state website. I don't know if we want to do this, that daily predicted deaths are listed currently at 50 per day, and actual number of 74 per day yesterday on the 15th of December.
Dr. O'Brien, maybe just for clarity, you could have a parenthesis that describes what the statistic social distancing at negative 20% from baseline. What is baseline? Is that the average number of people?
They would say that would be it's a number, I guess, that they have where it was pre-COVID of how we interacted. And I don't know how the state, that's on the state's website. They have that posted. And that's just how they list it. They have a running graph. And today's number was minus 20%.
So if we were, help me with the statistic.
Yeah.
If we were negative 20% from baseline and baseline was pre-COVID, does that mean that we are closer together than we were before COVID started in terms of social distancing?
No, we are 20% better, but we're not at 100% staying apart from each other. We are just maybe 1/5 to be totally apart, social distancing.
So I don't know, maybe, I know that's how they present it, but to me, that was not clear.
Yeah. We don't have to put that in there because of, again, that's just one of that's the second on the website. That's the number 2 graph that they show on the state website.
If you think that interested parties or the public would have no trouble with that, but it just seemed a little, the wordage just seemed a little odd to me.
Well, again, and this is for the governor and his staff. So hopefully they would understand it since this is from their website.
Okay.
Dr. O'Brien, this is Charity. I was going to suggest that we put according to in the website or something like that.
Yeah, from the State of Tennessee COVID-19 website. Oh, insert the link. Okay, yeah. That would be great. So we can just get that link. It's on the tn.gov. When you click on COVID is where it is. So I think that's probably what would be needed at this point.
I would suggest that we add because I didn't see it in here, a specific whereas about CDC and World Health Organization recognize mask wearing as an effective COVID-19 mitigation tool or something like that. I don't know how you want to say that. Because I think that the specific ask is about masks.
I have a question. Should we put cloth face covering or just mask?
They're used kind of in interchangeable. Yeah. So whatever the Dr. O'Brien thinks is most clear.
What was it in our county ordinance? Does anyone remember? What do we say? I think it probably should mirror that language.
I can look it up.
I don't know if it just says face covering. It may be face covering.
If we're going off of the CDC, on the website of the CDC, it says CDC recommends community use of masks, specifically non-valved multi-layer cloth masks.
So what is the makeup of an N95 mask?
Well, the problem with that is that's not something the public would normally use.
Yeah, that's specially crafted material,
Yeah.
obviously. Our reg says face covering. But I suggest we stick with perhaps the language. We can be consistent with our language or the language that has been used at the state level or CDC level.
So interestingly, on the N95 question, when you look at what is obviously the most effective of the face coverings, it would be an N95 or in some cases maybe less than that, a KN95. Those are increasingly available to the public. So, I see ads every day online for, a small box of those for $10 or $20 or something. Early on, they were very expensive. They were $10 each, and the price has gone down as the supply has gone up. So I don't know whether there's a specific mention of that needs to be made. Probably that would be confusing, and there may be people that couldn't afford that. But as the price goes down and that penetrates the market more, that would be the preferred face covering. There may be
well, they're really only indicated for medical procedures and not indicated for general public wearing when you're out grocery shopping. It's just, that's not the intended use of those masks. So I would not encourage us to encourage people to wear a mask that one, they are supposed to be fitted for it to actually work.
Right.
Is really indicated for something more than what we're asking.
They are out in the community, though, and they're available.
Yes.
I would just recommend we stick to the therefore to initiate a statewide face covering / mask executive order. That covers it all. The governor, if he decides to do this, he'll talk to Commissioner Piercy, and they will come up with whatever they want to do with this. But I think we're at a point where we have something we could give to them, and this is something that can be used by, like I say, some of the other groups locally if they wish to consider doing something the same. I think it would be best to hear from others in this county and this region.
Do you all want them to accept the changes so you can read it as we're going to vote on it?
Well, as the person who put it forward, I'll go ahead and move that we accept this as the amended 2020-B, and whoever was the second, I guess, see if they would go with it.
That was Dr. Drake.
I would go with it, but it's still a little confusing about the two different kinds of masks to me. I know the pharmacy community would like not the cloth because they don't seem to stay up over their nose. They fall down. So I don't know. People just aren't wearing them properly.
So I do think more than, this is James for me, I do think more than anything else we've done, I mean, it's the intent of this one that is, I mean, this is, as it's written, a request to the governor. And so I'm not sure the details on the mask versus face covering make as much difference on this as if it was something that was being implemented in our community the next day.
So I'm going to ask that you accept the changes that we've made, and I'd like to read it as what we intend to vote on. Thank you. I guess I asked that question for myself.
Quick question, maybe to Dr. Buchanan. Do we have data that is more recent than December 6, 2020, as far as those red zone?
No, that was the last White House report.
Okay.
And another one will come out this week, but that's the last one we have.
Okay.
Now the 1, 2, 3, the fourth and fifth whereases we probably could change to today's date for the benchmarks if we wanted to.
Okay. Because we're 5 red as we were last time.
Yep. Thank you. So.
Board members, any other additions, changes, discussions on this? Things that are jumping out at you?
Dr. Goetcher, as the one who did the second, I will do a second with all these amendments.
Thank you, Dr. Drake.
Can I move the question?
We sure can. If there's no other discussion, since we're ready to vote, so we can have a roll call vote on 2020-C as amended.
B, sir. B as in Bravo.
B as in boy, as amended. Sorry.
All right, this is Charity Menifee, roll call vote for, what was it again, 2020-B as amended. Dr. Drake,
Yes.
Dr. Goetcher,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
No.
Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan.
Yes.
All right, it passed 9-1.
Thank you very much. So you have passed 2020-B as amended. Next on the agenda is, since we had 2020-C out, and Mr. Sanders, maybe help me on this. Is this the place where we're inserting the resolution that came in late that we approved through the chair?
Yes, I believe so. You should be, there is no longer the resolution which Dr. O'Brien had labeled 2020-C.
Right.
You're now taking up the resolution that Dr. Buchanan labeled 2020-D as in Delta. That can be taken, there's no need to take it up as 2020-C or D. You can call it whatever you want, but presumably you would now call it 2020-C in order to maintain consistency.
So new 2020-C, and for some preliminary discussion, Dr. O'Brien, I believe you were the author of this as well. And then after maybe a brief discussion, let's go ahead and move in second so we can discuss it formally.
I'm not the author, but I'm going to move that we accept it.
Thank
So
you.
we have a motion, and do we have a second?
I'll second. And as the sponsor, I can give you some context and background.
Okay, very good. So we have made a motion on this and seconded it, open for discussion. Dr. Buchanan, please.
Sure. So as my staff and I, and as all of you have watched our numbers go up, and in particular our deaths go up and our hospitalizations, and we know those lag behind and it's only going to get worse. I have really struggled with what's the right thing for us to do as a board. What's the right thing for me to recommend as your public health officer for us to do as a board, and had lengthy debates with my staff about that. Understanding where we are with how people are accepting regulations or not. Understanding where we are situationally with the disease of COVID and how it's impacting our community, and understanding the economic impact of previously shutting down the community. And I've said before, the pure public health approach is just make everybody go home and stay home and shut things down, because we know COVID is a social disease, and if we don't socialize, we won't give it to each other. But tolerance for that, both as far as our economic tolerance, social tolerance, political tolerance for that, is very low in this community. And hope for compliance is, I think, equally low. And even as bad as the numbers are, I don't think they're bad enough for people to go, oh, I'll change how I see that and do things differently. So I actually worked on a resolution that would take us back to takeout at the restaurants and other things. And after thinking about it and having some conversations, came forward with this, because the message we want to send is you're safest at home. The safest place to be is with your household and at home, and encouraging our citizens to stay home as much as possible, reduce unnecessary trips, but then also giving our businesses some ideas for how they can play a role in reducing disease rates as well. So it's kind of a safer at home and business guidance resolution that I hope people will take to heart and follow.
So, Dr. Buchanan, I think the points in this that I've looked at are very well made. And, one problem that we wrestle with is that in the public health arena, we do know that strict lockdowns lower the R0 and lower that. But public health also includes that psychological component, psychiatric component, ability to work, all sorts of domestic violence issues and such. So it's a really widespread problem. One small light at the end of the tunnel, and I was listening to the news this afternoon before I came over, and it appears that our Congress is, winding its way towards some sort of bill, which may not be exactly the PPP of March, but it approaches that. So as things stand now, I think there's some relief in the pipeline. I don't know how soon that's going to arrive, but that's a little ray of optimism for the businesses that struggle under this.
Yeah, so I don't know if, there we go, there it is. So I guess the highlights of this that I just want to make sure everybody is aware of. So the whereases are basically, the whereases we use for everything with updates. So since you guys just got this afternoon, I think obviously you need to take some time to read it. So I will stop talking.
While people are reading, there's one typo, which I had the same in mind in the third whereas, between new case rate and percent positivity, and it should be new case rate and percent positivity.
Oh, yeah. Thank you.
Something simple.
Yep.
Dr. Buchanan,
Mm-hmm.
I noticed that that on this form, the small Roman numeral lettering continues from small letter to small letter. That is, it should start over with Roman numeral 1 again under L, and then I think further on it does the same thing.
I just unmuted myself to say the same thing. So I don't know who's driving. Is Catherine, are you driving?
We'll format that after the fact.
Okay.
This is,
We'll get that formatted before it gets signed.
yes.
I want to say, this is Pat O'Brien, while we're reading this, thank you for putting together such an excellent suggestion to the community. It's not an order. It's not making anybody do anything. It is recommending and giving guidance, which I think people really appreciate. So I want to just thank you for putting this together.
Well, I'm going to give credit to the task force that was initially working on creating plans for our community. And so most of this comes from the task force documents that were created way back in, I don't remember, March, April, sometime like that.
It feels like 10 years ago, but it's not. Yeah, I really appreciate the completeness. It's really a nice document, I think, Dr. Buchanan.
Oh, yeah, we have the same problem. We'll just fix it.
So, Dr. Buchanan, one question. I don't know if we're through most of it. I guess we're there to the bottom. And so on item 4, no, I'm sorry, item 3 there. I don't know if you could specifically comment on on that. I know this is not binding. This is a recommendation, but just the choice to include something about extracurriculars.
Part of that comes from some data. And certainly we can add that in there, but I mean, again, we can't tell the Board of Education what to do. When we look at schools, spread in the classroom has gone up recently, but just as spread in our community has gone up. But we also, so if you get one case of COVID on the basketball team, then you've got a whole bunch of athletes who are going to end up being quarantined. So especially with indoor sports, we know that the more people gather, the more opportunity there is to spread COVID. And I understand extracurricular activities are important, but I think we need to decide what our priorities are. Our priorities to educate our children and keep them in school? Or is it to educate children and also let them play sports and do the other things that they do? And I think if our priority is educating children, keeping more kids in the classroom and also more teachers in the classroom is what we need to focus on. And extracurricular activities don't really help us do that.
Dr. Buchanan, one thing that I would like to say about that, and I agree with Dr. O'Brien, this is finely crafted. Thank you. There are issues with extracurricular. For instance, some of these kids will be earning college scholarships and they won't be able to if they can't participate in extracurricular activity. So my suggestion would be to remove 4, or maybe replace it with some sort of more flexible verbiage where it gets the point across. At the same time, it is not, that's pretty strong here. And I guess maybe Ms. Wagner, would you have any comments on that? But I'd be hesitant to say that for spring you're going to cancel all extracurricular activity or encourage the schools to do that.
So I guess Mayor Jacobs, do you have a suggestion on amendment?
I don't. Actually, I don't. I think that's something we could discuss.
Okay.
Dr. Buchanan, instead of encourage to not allow, say to minimize.
Yeah, this is Maria. I was thinking something like to, discourage, minimize, reduce, just to let people know, look, we realize, a judgment call has to be made. The benefits we want the benefits to outweigh the risks.
What if we said...
And leave some wiggle room. And at the end of the day, this is just encouragement. I mean, we are not saying this is a law, a regulation, a mandate, et cetera. It's just our encouragement.
Would it make more sense to say limit as opposed to minimize?
I like that.
Yeah, I like it too.
Maybe some verbiage about, alternate ways or something like that, alternative methods, or, something to where, maybe you can limit spectators and that sort of thing more so than the kids participating. Or here's a good one: enact appropriate precautions.
They kind of already have those, but
I think looking at how the University of Tennessee has handled football and how they're handling basketball, limiting number of people there, and we're taking as strict an action as you can, but still having it open. Thompson Bowling holds about 24,000 people. I think it's limited to about 4,500, and Neyland Stadium about 109, and I think it was about 26,000, something like that.
hey, Lisa, you have a lot more knowledge of this.
Yeah.
Do you have any thoughts or suggestions?
About go ahead.
How extracurricular activities might be impacting what's happening at schools?
Yes, we've had a few clusters for basketball and football and dance team and all kinds. So we have a few going on right now. So the extracurricular activities, especially indoors, it does impact the number of cases that we have.
Are you limiting crowd size?
They're going to start that moving forward next semester.
Okay. I'm comfortable with these and consider them friendly amendments. I don't need to vote on the amendments.
A grammar or a typo there. Activities. It's if continue activities. It should be if activities continue. I think, or however.
You may want to add extracurricular in front of it so it's consistent.
Sure. So I accept those amendments. Anybody else have questions?
I have a question. This is Maria. And Ms. Wagner may have the answer to this. Are there already testing and contact tracing policies, protocols in place for extracurricular activities, teams, that kind of thing? And right now, or is there already something in place like that? And perhaps we could encourage that here.
Yes, we do contact tracing with all our students. And when we identify a cluster, we work with the health department and we keep track of those students, that particular cluster.
But I guess my question is there something in place specifically for gatherings like this, sports gathering? In other words, I'm asking beforehand, right? Well, testing perhaps, and/or
we don't have testing.
Happens. Yeah,
we don't have testing, but we do.
Is that something? So what I'm asking, I guess you and the group at large, is what do you think about encouraging that? I mean, we know that, yes, kids need exercise. Some athletic endeavors are not just for, and I don't mean just it doesn't matter, but not just for physical and mental health, but actually for a student's future. So I'm suggesting perhaps we encourage something in place to routinely test students who are engaged in extracurricular activities where they're going to be at higher risk for becoming ill just by virtue of being indoors or being in close proximity to each other for an extended piece of time. What are your all's thoughts about that? Again, just a suggestion, not asking it to be a mandate or a law.
I would, this is Pat O'Brien, I would maybe leave 3 as is, and just in the conversations that the health department has with the schools, that they could discuss those sorts of things, because that's a bigger bite, having testing through the schools, and you have to have money and staff. So I would probably err on the side of leaving that out of this piece, but make it part of the conversation.
I think it would be a pretty good piece of a budget to do that, based on what PCR or what the rapid test would cost. Now, I don't have the figures on it, but I understand in reading the University of Tennessee spends a fair amount of money on testing for their athletes.
We can certainly talk. We can certainly talk to the schools about that. But then the other side of that is you're also talking about a population of minors, and again, it just gets complicated. And obviously there's the cost associated with that kind of stuff, and but no, it's one way to help reduce risk. But as we've seen from the University of Tennessee, who is testing a lot, it doesn't totally eliminate it.
Any other discussion on, I guess, renamed 2020-C?
This is Ani Roma. I'm just kind of wondering aloud here. There's a lot in here about 6 feet. I'm wondering if it might be helpful to add something regarding square feet. A previous regulation that the Board of Health had, 2020-6, mentioned 25 people per 900 square feet. I'm wondering if that might be helpful or if it's just too much and not necessary. I just thought like I said, I was just wondering out loud.
Thank you.
So we still, and we actually should be on here. We still have 2020-8 in place, and it defines the square footage for 10 people. I mean, we could do that. I'm just not sure how you would add that. So that's already in 2020-8.
This is Pat O'Brien. I would probably leave it as is in this one, because we're just making a recommendation. So just a thought.
Any other comments or questions? We don't want to limit discussion on this, but if we're ready to vote, we can do so.
This is Lisa. I'd just like to tell Dr. Buchanan, thank you for including the bullet point 3 about the extracurricular activities.
You're welcome.
Thank you very much.
We have a motion.
We have a motion and a second, yes. And we're still in discussion. If we are completing the discussion, we can go ahead and vote, but I want to leave it open. People need to fine tune this. There's a lot here.
Okay, I don't know if I can get them done.
Since everybody has adjusted this or revised this to their individual or group satisfaction, is there any other discussion on this or any other additions or corrections? If not, since we're ready to vote, if it's okay, we can do so. And we can go ahead with a roll call vote on this.
All right, this is Charity Menifee with a roll call vote for 2020C. I believe is what we were naming this, correct?
Yes, that's correct, Charity.
All right, Dr. Drake,
Yes.
Dr. Gocher,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs, Mayor Jacobs,
Yes.
thank you. Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan.
Yes.
All right, passes unanimously.
Great, thank you. You have passed 2020-C as revised. Next item in the agenda is for review and discussion. The Regulation 2020-1, which was our resolution on face coverings back in July 1, 2020. Any new information, review, discussion on that? Remember, that is an open-ended regulation, so it does not have a set expiration date.
I have nothing new to report on our end.
Okay. Anybody have any comments on that one? If not, the next item is the restaurant occupancy limitation and early closure, which is 2020-7. And if y'all will help me on this, is this one up for renewal or is this an interim discussion?
It expires before our next meeting.
So really up for renewal then. Discussions, comments, sense of how it's working. We have members who have input from the restaurant community. Do we sense that this is accepted, it's working? Are there difficulties with the regulation in terms of executing it? Any comments, any discussion about that?
Can I give some feedback from some restaurant folks? The people that are doing this and doing it correctly feel that they're being taken advantage of by other businessmen and women who are not doing it and not doing it correctly. And they wish the playing field was more fair and wish that we would not continue this and instead let them try to do the best they can to mitigate the disease by following guidelines. The others are already not closing and they aren't acting in good faith. So that's some feedback I've gotten and I just want to pass that along.
Other comments? We know that the city is looking at beer board regulations on two establishments. I've seen that in the paper. Is it your sense, Dr. O'Brien or others, that it is more widespread than those two establishments? It
is. Those are in the city, and they are the kind of the tip of the iceberg, as I understand in discussions, that out in the county there is no stopping people at all in the county.
So I guess, we just had a discussion about our numbers and how challenging they are right now and how they're escalating, and we would like to change that direction. So I'm sorry, I'm trying to look up, when did we put this? I'm trying to remember when we put this in place. Anybody
Was it
else?
the Monday before Thanksgiving?
Yep.
Okay.
I think it was that emergency meeting.
Okay. So it sunsets. It started the Monday before Thanksgiving. So it's not even been in place a month, or maybe barely a month. Correct?
I think less than a month. Yeah, because I think we voted on it that Monday, and then it maybe went into effect on Tuesday or Wednesday.
So it's really pretty much impossible to know if it's been effective. So, if we want to say whether it worked or not, decide whether we keep it in place, that's not very useful because it's just been too short of a period of time. And as our numbers go up, and I just have a hard time letting go of something that has been done in other places and is recommended by it's a little less than what's recommended by the White House Task Force. So I would make a motion that we keep this in place for another couple of weeks. So I can do the math or get out a calendar.
Mr. Sanders, I have a quick question for you. If we decide to continue this 2020-7, do we vote on it as a new regulation? Is it renumbered, or do we, how do we navigate that?
I'll just vote to extend it.
Okay.
So it sunsets on December 23rd. So then you would extend it to January 6th or 7th, because January 6th would that be a meeting? Yeah, that would be our next meeting. So, no, I'm sorry, that would not be our next meeting.
Our next meeting is on the 30th.
Yep, sorry. I'm just doing the math wrong. So 2 weeks from the sunset would be January 6th.
So would we need to vote on it at the December 30th meeting then?
No, because if we don't vote on it today, you mean vote on it again or consider it again?
If it expires on the 6th and our meeting is on the 30th.
Consider it again at the next meeting. Yes, that's correct.
So this, instead of being, it's a 2-week cycle. So it's each meeting we look at it is what I'm getting the sense that we're doing.
We don't have to do that, but I was just. So, I made a motion. It doesn't appear that I have a second. So
I'll second it.
There we go. So we have a motion and a second. So further discussion. This is for reinstituting 2020-7.
Until December 6th, extending it to December 6th.
No,
December 6th.
January 6th. Thank you. Thanks.
With the intention of being able to see if there's any impact, I'm wondering, first of all, if there would be a way to tell. First of all, I don't see how we could tell if this would have made an impact on the numbers come January 6th, if it would be this alone. If somebody could educate me and help explain.
Well, the reason we put this in place were a couple things. One is that there was a study that the CDC did looking at people who have COVID and people who don't have COVID, all who've had symptoms. And what they found was that the people who were positive for COVID were more likely to have eaten out at a restaurant the 2 weeks before they became ill. And we know that socialization and gathering are ways that people transmit COVID, and you can't keep your mask on while you're eating and drinking. So limiting some of those activities at restaurants is one way that's been seen across the country to reduce disease. So that's kind of where we're coming from. It's the only, is it helping reduce? Would our numbers be higher if we didn't have this in place? That's a question that we can't answer, to be honest. It's one of the challenges of prevention and public health. There's so many different factors that influence cases and disease that it's hard to say that one thing we did made an impact. But I just go back to our numbers really are not good now. And is this the right time to back off? And so that's why I'm putting that forward.
Thank you for reminding me. I remember that now. I don't know. I go back and forth because it's just one thing, and there's a lot that goes into this. And so it just, I I don't know, we still have those that are resisting, and I'm wondering, I don't know, I'm going to stop talking.
I'd like to bring something up that was brought up to me in some discussions I had. A request was this until just now for us to consider if we were still doing this at this time, because this is an important time of year for businesses in our community. If we were going to continue it for a 2-week period, this 2 weeks we're talking about, that we would extend it to 11 p.m. So I had some people talk to me. That's what they asked. I just want to lay it out there. These are some folks in the community who were hoping for giving a little for them, wanting to add 1 more hour to their ability to make some money.
And then in addition to that, we all received an email from a restaurant in particular who just isn't on the same business model as everybody else. It's a 24-hour establishment that's they pointed out that they're kind of the beacon of light in the dark for those who need a place to just kind of grab a cup of coffee, and those first responders and those who are working around the clock to help others. That's one that's kind of weighed on me as well, that I've just kind of kept in mind.
Strom, I agree with that, with your comments on that letter. That was kind of touching, and it was a different look at things. We don't usually think about those subtle things that go on, but there are restaurants that stay open all night that, you know, work with the late shift workers and such, and that's an important thing. Those of us who, you know, get up in the morning and go to bed at night, we don't see that side of the world often, but it's true.
And just to remind all of us, and the public especially, does our order cover all restaurants or those that just serve alcoholic beverages? So I just want to bring that up.
So yeah, it's not Target, it's all of them.
I think to the points that have been made, the challenge where we are right now is that given that positivity rate that we have, it's going to be very difficult to know on any given measure how much it would have been, what it would have been like had we not enacted more. And so that's going to be a real challenge we're going to be dealing with for the next few months. And I wish there was a way around that. And I guess the other thing, this gets back to what we did earlier in the meeting, is if that 65% masking was 95%, maybe we would be having less of these types of discussions. I don't know that for sure, but that's a less intrusive thing than what we're talking about here.
This is Mayor Jacobs. I'd just like to throw this out too. I believe that part of this, we were talking about bars and restaurants that UT students frequented. And of course, I think they're out of class until, I believe, like January 10th or something like that.
January 20th is first day of class.
Yeah, so that some of the concerns that the board had might be mitigated by that.
My concern is that holiday gatherings will kind of replace that, at least for the next few weeks. And so again, how much is being followed? First of all, that's very clear that that's not consistent. The other thing is that, there's if I remember the time, the closing time, and then there's how many people are together. And so this one's hard to know what the impact is. I certainly understand what Dr. Buchanan is saying, in that if you look at our numbers and we were starting with this, and it wasn't that we were 8 or 9 months in and we hadn't already had a big close down in March and April, I mean, there's no question what we would need to be doing right now as far as being more aggressive. But this is where we are. And so it's a bigger discussion. It's almost like mask or not, and then are you going to do anything? That's almost kind of where we are in this type of conversation. And I think there is this natural instinct with the numbers being where they are and where they're headed, that to do nothing effectively is a difficult place to be. But to be able to say the effect of what we do is also going to be very difficult. Unless something very drastic was done, and you could measure that if it was followed. And I think we all know that that's not very likely to happen.
Yeah, this is Maria. That's the challenge of public health measures. Kind of like the analogy I use with my family and friends is it's like the Secret Service. If they're doing their job, you don't know how well they're doing their job. All you know is that, let's say, a high-profile person like the president or the governor, or whatever, has not been harmed. With that said, I'd like to remind everyone that part of what has driven the decision to even craft this this resolution, this regulation, is based on the White House coronavirus task force, and they recommended, having recognized Tennessee as a red state, a state in the red, and Dr. O'Brien mentioned earlier about just how bad our numbers are statewide. But this regulation was based on White House task force recommendations, and they recommended reducing everything to 25% capacity. So what we've asked, although it's painful, and I am not in any way disregarding the stressors it puts on businesses. We tried to make it a level playing field, but it is still mild compared to what the recommendations are, which is 25%. So to use your phrase, Dr. Shamia, you've said more than once, now's not the time to let our foot off the gas. And yes, this is one of those really difficult decisions that we have to, consider and make.
Yes, that White House report not only recommends capacity at less than 25% now, but also closing bars altogether. So this is, I hear you, and I recognize that, yes, this is still considerably less than what's been presented. It weighs so heavy on my heart. I know it does on you all too. It's the worst.
Other points of discussion? Any discussion about amending or changing the regulation for the next cycle? I'm certainly open for discussion on all those points. Hearing none, are we ready to vote? I believe we have a motion and a second on continuation until January the 6th, if I remember the motion correctly.
Yes, we do.
Any other discussion on that? Hearing none, since we're ready to vote.
All right.
So we need a roll call vote, please, Charity. Thank you.
Yes, sir. So the roll call vote on 2020-7, extending until January 6th. Dr. Drake?
Yes.
Dr. Gocher?
Yes.
Dr. Hurt?
Yes.
Mayor Jacobs?
No.
Dr. O'Brien?
Yes.
Ms. Roma?
Yes.
Dr. Shamia?
Yes.
Dr. Souza?
Yes.
Ms. Wagner?
Yes.
Dr. Buchanan?
Yes.
All right, it passes 9-1.
Thank you. Thank you, Charity. So this concludes the portion of our agenda dealing with our regulations and proposals. So we are in the other business section. And I believe, Dr. Hurt, there were some points of discussion that you wanted to have. So the floor is yours if you would like to lead us in that discussion.
Sure, thank you. So I've been thinking about this, as I imagine we all have, for some time. And so bear with me. I'll try to keep the floor for my 3 minutes. And this comes in 3 parts. And the first part is I just want to share with my fellow Board of Health members, to take heart. The history of public health goes back to the 1300s during the plague, when boards of health were created, where quarantine was developed, where we created sick from well wards, and there has been pushback for hundreds of years with public pushback. There's even during the plague, there was public outcry. There was a lot of fear and blame and revolt, and public health officials got a lot of heat, and sometimes were really injured and killed over the decisions they were making that they believed were in the best interest of their community. So that's part one, is that we are carrying on a long tradition. And the second part to this is I would like for us for a minute to consider, and anyone who's listening to consider, that the task we've been given is not something we signed up for. It pains me to be accused of power grabs, exerting power, trying to control people. I want everyone to consider for a moment that at least 1/3 of us, to the best of my knowledge, were asked to join this team. Signing up for one thing, but I would say that's probably true of all of us. I want us to imagine if you were given a job that you signed up for, and then on the turn of a dime, totally unanticipated, you were told, you're going to have to make decisions that are going to affect the health, the well-being of tens of thousands of people. And you're not going to be allowed to talk to your team members ever, except when you're allowed to meet. And you're going to be recorded and televised. And you're going to face a lot of pushback. But your job is to do the best you can, given the information you have, the most up-to-date information, to consider the well-being of most people. Those facts, in terms of signing up for a job, make it hard enough. But then to be intimidated, bullied, threatened, etc. I mean, those are challenges that I want us to consider. Have made it all the more remarkable that we've stuck with it. Dr. Gotcher, at one point you mentioned, you were raised to believe that once you're given a task, you're supposed to complete it. And that's what we've done. And this all leads into point 3 of what I'd like to share, which is we are, as an entity now, at a place where, County Commission has drawn up a resolution amendment to disband us, dissolve us, And I find that the important thing, the deeper question for me, and I hope for others, is to ask why. Because we, in the board our board did not initially have. Well, we've always had Tennessee Code annotated authority and power to do what we've been tasked to do the past 6 months. But traditionally, to the best of my knowledge, we haven't implemented regulations. But that was taken from the public health officer by the county law department, given to us and now it's potentially being taken away from us. And I'm not complaining. I'm simply stating the facts and asking why. Why is it now being the decision-making power, which was given to us, now being taken away and putting back into the public health officer's court? And I'm not saying it shouldn't be, but I'm wanting us. I just like to put that out there. Why? What is the deeper why? This back and forth. So that's what I'd like to know what your all's thoughts are, because I don't know. We're not allowed to communicate with one another. So I guess that's partly a pep talk and partly it's not rhetorical. I really would like to know what you all, as my fellow team players, what your thoughts are about the upcoming regulation. And then at some point, I'll also have some questions for Mr. Sanders. Thank you for giving me the...
Dr. Hurt, I'll give you my thoughts. To me, again, we've been given a task based on the law, and we've been given a task based on our willingness to help. It doesn't matter to me in a larger sense who gets the job done. If the governor is the person, if the president of the United States is that person, if our county commission, if our mayor, whomever, as long as somebody steps up to the plate and does what is necessary. We have been tasked with stepping up to the plate. If somebody wants to accept that job and the responsibilities, gosh, more power to them. If we will fit into the role of advisory, as long as somebody is willing to make the hard decisions based on the best information available, I have no qualms with that. We serve at the pleasure of the county commission. We serve at the request of our professional organizations, and whatever we're tasked to do, I think we should deliver on. But if it's an advisory only, as long as somebody is responsible, that's all I would care about.
I'd like to just say one thing that I hate to see a change back to the public health officer being all that's being put on her shoulders. This spreads around that responsibility based on state law. This spreads around the available inputs from a variety of backgrounds. Yes, we could be an advisory board to Dr. Buchanan. The public should understand that she would make those orders. It would not be the county mayor, it would not be the county commission or any other entity, as I understand it. It would fall on her shoulders. I also, by me reading the TCA, believe that it would be on her shoulders if they got rid of us, for her to put together an advisory board versus the county commission to do it. That's something for the legal minds, but that's my personal read of the TCA, that it falls then to the designee of the Commissioner of Health, i.e. the public health officer, to look for an advisory group. But again, it's tough in the middle of a pandemic to make these sorts of changes. And I would ask the county commission, if you have questions of us, call us. I've spoken to 2 county commissioners recently. We are all open to that discussion. Unfortunately, we can't talk to each other here other than right here. So we need to mutually support each other. We don't want to see what happened in Idaho happening here. We don't want the rhetoric to spill over into mob action that has happened in other places. We're better than this here in East Tennessee. And I would hope our county commission might look at us as being pretty reasonable people. Yes, I scared some people with what I put on the agenda. I know that. But we came around and came up with something that made sense. So one thing that the public needs to realize, our county commissioners need to realize, because we can't speak, what you may see there may not equal the end result. It's like sausage being made. Same thing here, like at the General Assembly or other places. We have to get all this information, put it together, and come up with a plan. So I would, again, I would like the county commission to just maybe take a breath. We take a breath. We're all in this working together for the betterment of our people, of our citizens. And I don't want too much to be put on the shoulders of Dr. Buchanan. I think right now is a tough time. And if it's just her alone, I don't think she deserves that. I think we can help shoulder that some with her. And I would encourage allowing us to continue through this pandemic to get that job done.
Dr. O'Brien, I would simply echo that about that. I think there is some misperception that, who is the advisory board to? If it becomes an advisory board, it's to Dr. Buchanan, if I understand that. And so the idea that the decisions that have been made up to now would have been fundamentally different. Yeah, there may have been the timing might have been different. Maybe some details would have been different. But the idea that the course would have been totally different without a Board of Health, I think is unlikely. But what it has done is given a forum to exchange ideas, to collaborate, and to not put all of it on her shoulders. So as an advisory group, we still can exchange ideas, we can still collaborate. But I do think in the middle of the pandemic, and honestly, County Commission was quite complimentary of Dr. Buchanan, at least the parts that I watched. And so I don't know what it really serves is to necessarily put this, all squarely on her shoulders. So that's one thing. The other thing that again, right in the middle of all this is that it just seems like there's other things we need to be as a collective society talking about right this second. I mean, the focus more on the pandemic and the economy specifically. And I know that the idea is some of the things that we've done have had the impact on the economy, but the COVID at the end of, when this is all said and done, COVID will have had much more impact on the economy than any specific regulation. I know that there are specific people who have had dramatic impacts from these things, but on a larger scale, it's going to be COVID. So I just the more that we focus on that, and then kind of deal with all this later when the dust is settled, I think maybe serves the public better. But I'm right with Dr. Gocher. It doesn't matter to me as long as there's somebody at the end of the day who is accountable and willing to take that responsibility. But I hate that to all be on Dr. Buchanan's shoulders when she's done such a fine job. And I would just want to make sure that the County Commission realizes that that's what ultimately is going to happen out of this.
Thank you, Dr. Shamia. Other comments, discussion? As a group, we don't get a chance to have these discussions as often as we should. I'm not saying we should meet more often, but we don't have a chance for this. So comments from any of the board members?
I just want to thank Dr. Hurt for bringing this up. I think that probably all of us are kind of feeling the fatigue of this. The whole situation I think we said it long ago, probably when Ani joined us, that we're not going to be perfect. We're going to try and thread the needle, but we're going to do the best we can. And just thanks to Ani. I know that you spoke on Monday at the commission meeting, and I applaud that. It's I keep telling myself I want to get out there, but I think most days I feel like a kicked dog. And so it's a little bit tough to do that. So applause to you. But no, I agree. I think that, if we're advisory, if we're making the decisions, I'm fine with it either way. But I agree that, do we want to put more on Martha's shoulders? Because right now, at least we're kind of all shouldering the backlash.
Thank you, Dr. Sousa.
And I would just say that, I appreciate the joint decision making. And obviously, if you are advisory, that won't change. Because we'll still be advising. But it's nice to have also the shared responsibility. And I know, and I appreciate all of you sticking to it, and Ani, you coming on, because I know it's not been easy, and this has not been an easy time, and it's been very different and very unexpected and very different than what I described to you when I asked you but when I talked to you about being on the Board of Health, because I didn't ask you necessarily, you got nominated. We talked about being on the Board of Health. It was not, wasn't what I described because we'd never been here before and we'd never done this before. And so this kind of blindsided all of us, but I do really appreciate all of you stepping up and I appreciate the input and the different points of view. If they do choose to make you advisory, I hope they don't choose to completely disband. I don't think they're going to do that because it is nice to have this plethora of input.
One thing the problem would be is they have to disband us to make this happen where we would be advisory only. They don't have the legal standing, I don't think, in state law to make us an advisory committee. They either have to have us and follow the TCA or not have us and follow the TCA. The last thing I want to say is I want to thank the staff of the health department. They have gone above and beyond every day, day in, day out. I worry about their safety. I worry about the threats that they've gotten going into places, and they are phenomenal. And our public needs to thank them. Anytime they see them, they see an inspector out, they see, Charity on TV or whoever, please thank these people. They are tireless public servants. And I am just so impressed by them. And I'm so thankful that they're in our lives here locally. And kudos to you all.
Thank you, Dr. O'Brien. Other comments? I think this was time well spent. I appreciate everybody's input. So we know we have to tell each other to be safe because of the pandemic and just be safe in your day-to-day life. It depends on how far you want to go into the darkness of the web. You might hear some things about our board that are disturbing. I've seen some of this stuff and it's not pretty. So be careful out there. We can entertain a motion for adjournment if someone would like.
I'll make a motion that we adjourn.
I don't even know if we need a second, but I'll second that. Thanks, everybody, and we're going to be back on the 30th, which incidentally is my wedding anniversary, so we're going to maybe keep it a little shorter, hopefully. I don't know.
All right.
Thanks, all. Good night.